Welcome to HIMSTalk.ph, the official talk show of HIMAP, the Healthcare Information Management Association of the Philippines. HIMAP is an industry association comprising of companies providing healthcare information management services to global clients. I am your host, Vincent Tremo, and I am joined by my co-host, JL Butor.
Thank you, Vince. HIMS is short for Healthcare Information Management Services, and in this show, we will be featuring companies who have become part of this growing industry in the Philippine setting.
We will introduce case studies, meaning actual experiences of Philippine-based companies focusing on how their solutions and services help the global healthcare ecosystem by simply serving the needs of their clients. This is HIMSTalk.ph. This talk is all about HIMS.
We've got an exciting show for you today. Our topic is continuously improving patient experience through utilization management, the ADEC story. Allow me to introduce our speaker. Our speaker is an experienced leader with work exposures in multinational and local corporations, operating with thousands of employees in business process outsourcing, sustainability, education, healthcare solutions, and information technology. He has 25 years of solid track record in internal audit, being a certified quality associate, certified risk management assurance, and lead verifier for greenhouse gas. He currently is the general manager of ADEC Solutions USA, the US BPO arm of ADEC Innovations, providing solutions to top logistics, bank, insurance, and healthcare companies. Mr. Katahan is responsible for overseeing its onshore site as well as the distribution of work to ADEC Innovations offshore facilities located in the Philippines, China, Kenya, and Ireland. To talk about healthcare solutions offered by their company, let us welcome the General Manager of ADEC Solutions USA, Mr. Anthony Katahan.
Good morning. Thank you, Vince and JL, for having me. It is our pleasure to represent ADEC Innovations Healthcare in this HIMS Talk.ph. ADEC Innovations Healthcare is actually part of ADEC Innovations. We have operations or active business engagement in the 6 continents with 20 plus locations in 18 countries. We deliver solutions to healthcare providers such as hospitals, clinics, and medical facilities in processing their administrative tasks, helping them to focus on their core patient services. Our dedicated and experienced team composed of registered nurses both here in the US and in the Philippines and allied health professionals that ensure our commitment in providing reliable and quality services. We are a client-centric organization. From our founders to our frontliners, we're focused on delivering our promise. We take pride in being good in what we do. We have a robust support structure that includes global standards and compliance, quality, workforce management, business intelligence, analytics, knowledge management services, software as a service, and data as a service. We are built to develop and sustain long-term relationship and have a strong core dedicated healthcare leadership team averaging 16 years in professional excellence. Today, I would like to focus on a few of our services that we provide to a group of hospitals here in the US. One of which is actually we call utilization management review. Utilization management review is a process that evaluates the efficiency, appropriateness, and medical necessity of the treatments, services, procedures, and facilities provided to patients on a case by case basis. This is actually divided into 2 areas: admission review, which pertains to patient that is just admitted into the hospital, and continuous review, which pertains to patient that is still in the hospital and still being treated. One of the services that we also provide is what we call transitional care management, because this allows physicians to receive reimbursement for improved quality and reduced spending by reaching out to patients after discharge and reconciling medications, scheduling timely primary care visits, establishing plans for addressing common problems and coordinating with post-acute providers. Ancillary modality is actually a service that allows physicians to receive reimbursement for improved quality and reduce spending by reaching out to patients, verification and scheduling timely outpatient procedure such as breast and radiology procedure. Now, moving on to one of the critical services that we provide, especially this time of pandemic, is actually training home care or healthcare professionals, patients, and caregiver. And this is pertaining to 800 peritoneal dialysis patients that we support in the Philippines. Through the use of augmented reality, our nurse product specialists provide health coaching that minimizes post-procedure complications. So this allows and train the patient, their loved ones, the caregivers, the healthcare professionals to perform peritoneal dialysis on their own. And this is being done to support the patients that have financial challenges. You know very well the cost of going to a hospital or a clinic, especially if you're coming from other provinces and going to Metro Manila. You know how much it will cost for them to do this. So with this online support using the augmented reality, we were able to train their loved ones, the patients, the healthcare professionals to perform it on their own with our qualified nurses behind the platform, making sure that they do it properly. Another area that we do is, of course, revenue cycle management. This is basically the basic services that we perform and support some of the clinics, home cares, and a few hospitals here in the U.S. It's about of course, when you talk about revenue cycle management, you're talking about accounts payable that would involve invoice verification, document management that includes indexing, sorting, and uploading of documents in patient file, and even some billing notes. This is a data entry of bill or invoice in the patient's system. So this is some of the few services that ADEC Innovation Healthcare are providing to a number of hospitals here in the U.S. And we are committed to continuously uh, support, especially this time of pandemic. Uh, Hospitals are in need of the help, and ADEC Innovation Healthcare is always there to make sure that they focus on their patient care, and we provide them the services on their back office. Thank you.
Thank you very much, Anthony. That was very enlightening. We now understand the variety of services that ADEC provides to your global clients. You have 20 plus locations all over the world, and that's quite admirable for a company which has its roots also in the Philippines, as if I recall it right. In terms of your healthcare business, can you walk us through how this all started? The journey of ADEC towards starting the healthcare business and eventually focusing on utilization management as one of your core businesses in the healthcare sector.
Thank you, Vince. To give you a short or a brief history, ADEC has been involved in healthcare support or business for almost like 15 years, with our 30 years of the experience in the industry. Uh, we started from document management actually for hospitals. In fact, the site that I'm managing right now is actually still doing document management for some of the hospitals in the area. So even before we involve ourselves with utilization management, healthcare support is being a part of our business. Okay, but in the last 3 years, we are actually approached by a colleague of our CEO, Mr. James Donovan, through the American Chamber of Commerce in the Philippines. Then we were asked if this specific job is something that we can do. You know very well that anything about data, that is our actually golden thread. ADEC is a data assurance solutions company. So we decided to meet with the client and understand their business, and eventually we said, oh, this is something that uh, we can build as another vertical for ADEC Healthcare. And this was 3 years ago. We started with five nurses. Right now, we have at least 350 nurses that is supporting the group of hospitals in the Philippines. Historically, Vince and JL, that ADEC have different story. I mean, this is an organization that started or originally in the Philippines and branched out outside the Philippines. So with that in mind, we know that the nurses that we have in the Philippines is more than capable enough to support the needs of healthcare requirements, not only here in the US but also in Europe and other parts of the world.
That's nice to hear, Anthony. And unlike other companies who may have encountered problems in setting up, I'm just curious that with a company like ADEC, when you branch out into the utilization management service, are there any pain points that you still encountered when you set this up and when you run it?
Of course, it's not a perfect journey. But what I can tell you is that at the end of the day, it's all about the leadership. It's all about understanding the client. And with that, we were able to formulate a strategy that made it successful. Would you imagine, from document management to high level knowledge processing outsourcing support that would require highly skilled nursing professionals. And we are not just talking about nurses that are Philippine licensed. We are talking about nurses that are US licensed as well. So definitely there are bumps along the way, but with the right leadership and approach, considering that ADEC is an ISO certified organization, there are parameters that actually help us go through and overcome these challenges.
Wow, that's quite interesting, Anthony. Now, in terms of the service that you're providing from the Philippines, it's some kind of a business process management kind of thing, right? It's a service being done from the Philippines. What would be the basic skill set of the people you hire to do the job, and how fast were you able to build up this team of from 5 to 300?
So 90% of the 300 plus support that we have in the Philippines are actually registered nurses, a combination of Philippine registered nurses and US registered nurses. And it's not easy. And you know very well the demand of nurses, not only here in the US but in other parts of the world. So, but and at the same time, we have to make sure that whoever we get in a position actually fits the client requirement. So it took us a while actually to go through with the process until we were able to create a model that gives us a better perspective on the turnaround time and making sure that the client actually understands it. Um, right now, we already built that cycle and we have a number of the pool that are on standby so that whenever we need an expansion, we have nurses available already. But of course, it doesn't mean that it's smooth sailing. Of course, you know very well the retention rate in the Philippines, specifically for nurses. But I guess as I mentioned earlier, with the right leadership and approach, and how you actually take care of your employees is one of the important part in making sure that this project will be successful.
Yeah, Anthony, looking into the operational side, we would like to understand better. Are there work rendered from the US side with ADEC US, or are these only workforce rendering service from the Philippine side?
Thank you for that question, JL. Actually, everything's been done in the Philippines. So all of those 300 plus nurses are actually based in the Philippines. Some of them are actually in Manila, and some of them is actually in some of our location in the provinces. But all of them are actually based in the Philippines, and we are actually operating, uh, I could say 24 by 7 in a sense, but because remember, we are supporting hospitals, and you cannot really schedule the admittance of the patients in the hospital. So there are nurses that are on standby even during the weekend to make sure that we perform utilization management even during weekends, so that when they come back in the morning and on Monday, uh, with the doctors and the nurses, we make sure that all the records and documents are ready for their approval.
Now, following through the operation side, what is the typical day in the office for this type of service? Can you walk us through a sample process flow that starts with the shift of the Philippine nurses?
Actually, it started, of course, in the U.S. Time, where the typical working hours. But uh, in our operations in the Philippines, they work actually in 3 shifts. We make sure that we cover all the requirements that our clients or the hospitals would want us to cover. So we have to understand that these are numbers of hospitals, so they may have different requirements on different shifts. So we make sure that there are nurses on standby that are dedicated to that hospital and making sure that whenever the documents comes in, there is a nurse on standby to make sure and process it, and bring it and give it back to the hospital within a certain period of time. For example, there are documents that we need to review within 24 hours. There are documents that we need to review within 36 hours, and some documents are like 3 days or uh, 54, 60 hours. So, but there are also cases that this is what they call the ED support, the emergency department support, where we need to provide a review within 30 minutes. So it really depends on the specific requirement of a job by a specific hospital. So, but we make sure that we have nurses on standby to cover those requirements.
Anthony, let me clarify the stakeholders or the key players in this scene. You have the hospitals, and you have of course, the administrators of the hospitals. You have your operations in the Philippines. Who are the key players, and how does ADEC provide value? What's the real value that ADEC provides doing your operations from the Philippines with Philippine-based registered nurses?
So, okay, so one of the area or the key points, of course, is cost efficiency. You know very well that that's one of advantage of services being performed in the Philippines. But most importantly, especially during the times of pandemic, there are shortages of nurses here in the U.S. And this is where we came in, and brought more value than we had, because given the shortage of nurses, there's so much paperwork that they need to accomplish to make sure that they will be able to get paid by the insurance companies, right? So during the pandemic, there's no time for the U.S. nurses to perform this. That's why they requested ADEC Innovations Healthcare to make sure that we have 24/7 coverage and we have enough manpower to support these requirements. And I guess we were able to help them through that, and they are very much appreciative on this. That's why they continuously grow the business organically. They keep adding hospitals, especially those that belong to a group, because of the experience that they had, especially during the times of pandemic.
While we're on that discussions, Anthony, can you tell us what basically is the added secret sauce for the BPO service that you provide that better provided or highlighted the value that you are providing to your clients?
Despite of the challenges of the onboarding nurses, despite of the challenges of retaining nurses, it's really more on listening to the client and understanding their needs. We don't, you know very well that we don't say no to a client requirement. We make sure that we try to listen to them, and if it is something that we believe that we can bring value, then we'll try our very best to find ways to create different frameworks, different models that would meet that specific requirements. And this actually are appreciated by our clients. There are times that uh, the services that they require is actually out of our out of our scope. But given that it's still within the healthcare sector, uh, ADEC being part of the ADEC innovations, or at least ADEC Innovation Healthcare being part of ADEC innovations, have different ways to address this kind of concern. Being in a group is actually an advantage because you have other resources that you can pull in whenever you needed them.
Anthony, my next question would be, how did your service or how does your service help the overall healthcare industry of the US? I think it's a grand question, but I guess that your company is really up to the challenge. So I'll ask it anyway.
Okay, so of course, if you're talking to the stakeholders, at least to the chief financial officer or to the board of directors, at the end of the day, they look at the bottom line. At the end of the day, they would see, okay, so how much are we saving for this engagement? But you know what? Most importantly is the value that we are bringing to the nurses, to the medical professionals. Because as I said earlier, uh, during the pandemic, specifically during the pandemic, it lightens their load. Would you imagine with the shortages of nurses and everything, and you have a number of hundreds or even thousands of patients coming into your hospitals? How could you be able to manage the back office side, or the administrative tasks that are being that they require to do? Because if not, they will not be able to get paid by the insurance provider. Or if not, I mean, they will it will cost them a lot, because you know very well that with the influx of patients and challenges during these times of pandemic, um, you have to make sure that you still work efficiently, that you make sure that whatever medical needs is being done appropriately, because if not, it will be the cost of the hospital and not by the insurance and not even with the patients. So with our support, I believe just lightening the load of these nurses and medical professionals and allow them to focus on patient care is actually the value that we are happy that we are bringing into the table.
Certainly, ADEC did an amazing job in cooking in the service and rolling them out for the US market. Now, do you think there would be similar opportunities for this type of service in other regions?
I believe so. I believe so. In healthcare, I guess the U.S. and Europe still leads the race, right? Um, but these services is not only limited, at least within our clientele. There's so much healthcare requirement here in the U.S. that the Philippine industry could be able to support. And I can tell you that the one of the support that I could probably mention in this discussion is the support that we are receiving also from the Philippine government, the Department of Trade, and even the consulate offices are very supportive in making sure that if there's a need that we have here as a Philippine company, they are there to provide those support. So I would like to commend, of course, DTI, BOI, and even the consulate offices here in the U.S. for that kind of service that they provide to the Philippine company that operates here.
Anthony, you mentioned that you also have a service that utilizes augmented reality (AR), right?
Hmm.
Um, Now, what's your take on disruptive technologies and its effect on your business or impact to your business? Is it something that you would explore, or is it something that is a threat to your business?
No, actually, at the end of the day, it's adaptation is the key to make sure that you'll be successful in any types of endeavor that you have. So for ADEC, uh, even years back, we are anticipating that technology will come in and might might replace some of the body that we have, but they cannot totally eliminate the human factor. There's always be a human factor to be able to operate all of these things. On the other hand, we're looking at it to take advantage of these disruptive technologies, adapt with it, and be able to scale that to a new business model. That's what we do. So, regardless of whatever technology that we might be encountering ahead of us, ADEC is happy to explore and even be able to help uh, other industry or even other businesses in the Philippines to make those changes. Right now, those augmented reality actually supports 800 patients that in the Philippines that have some financial challenges to go to the hospitals. I'm sure there will be a lot of technologies that will come out eventually with a good intention, of course. And with that, we are prepared to adapt to it.
Well, certainly our discussion today has been a lot of information, and I wish we still have more time, but I guess that's all we have for today. Once again, we would like to thank our guest, Mr. Anthony Katahan, General Manager at ADEC Solutions USA.
Thank you, JL. Thank you, Vince. It's a pleasure being here and great to see you guys. Hope to see you in the next games next year.
In this episode, we got a glimpse of the intricacies of the US healthcare system and how a variety of solutions and services enable the said industry. We have also seen how a combination of operations in the US and the Philippines brought value to all the stakeholders in this field. It is our hope that services like these would grow and collaboration between US and Filipino companies would flourish, all for the benefit of the US healthcare industry. Because at the end of the day, it is all about providing the best possible care through efficient and effective healthcare management solutions and services.
Join us again next time for another featured case study. We are your hosts. I am Vincent Tremo.
And I am JL Butor.
Thank you for joining us, and we hope you'll join us again in future episodes of HIMSTalk.ph. This talk is all about hymns.
Keep safe, everyone.
Bye.